I'm Dr. Nicole Vaughn, and I'm assistant professor at the Drexel Dornsife School of Public Health. About 6 or 7 years ago, I was working with the Philadelphia Collaborative Violence Prevention Center in Philadelphia, and through that project we were working on violence prevention activities in the Southwest community. And with working with the community leaders, we recognized that trauma really was at the base of the issue with the violence prevention work that we were doing. We worked with them for a number of years, and in those community advisory board meetings, they really told us a lot about what the community was facing, the different types of stressors, and the different kinds of programs that were needed really to begin to combat violence in the city. In recognizing trauma as an issue, in the Violence Prevention Center, we were working on Community-Driven Research Day, and as been working in Community-Driven Research Day, we met up with City Lights, a community organization in Southwest Philadelphia that was really integral to bringing individuals from the community together to learn about different resources and network them together with different resources. And through that partnership, we began to really work on thinking of solutions to figuring out how community members can work together and become more trauma-informed over time. In doing that work at Community-Driven Research Day, City Lights and myself and another community research coordinator, Crystal Wyatt, we put together a proposal that really addressed many of the needs that the community was facing at the time. One of the things that we were really critical in looking at more critically was the issue of the daily stressors that community members were facing, the daily stressors of community leaders who were really the frontline individuals and the go-to individuals that community were seeing when they were having many different problems. And what we really recognized was that the community leaders were really resilient because they really were focused on being the frontline individuals that community really could rely on. And we wanted to learn more about their stressors as well as what to do to support them in the role that they were in. So we decided to put together a proposal and a project that really addressed those stressors and really focused in on ways that community leaders could cope and become more resilient in working with individuals in the community. So the first parts of the project was we designed a community survey that we were looking to elicit the different coping strategies that community leaders were using. We also wanted to identify the stressors that community members were having related to their own personal life as well as to the work that they were doing in the community. Many of the leaders were go-to individuals such as preachers and block captains and child care providers, community workers, and so they were really the people that individuals really sought after when they were going through issues in their daily lives. So we did surveys in the community. We also held focus groups, and we also gave a sanctuary training. Sanctuary was an evidence-based model that really looks at a trauma-informed way of delivering care for individuals. And so as part of that 3-step process with the community project, so the surveys, the focus groups, and a brief training in the sanctuary model, we were able to really understand more about what the community was facing and the community leaders were facing in doing their role every day. The training was received really well. The community leaders gave us a lot of feedback. They really understood that the communities that they were serving really needed to understand more about how trauma affects the brain, as well as the different types of resources that they could put in place to really help community members when they come to them directly. They also learned a lot about self-care for themselves. That was one of the things that was identified in their focus group with us, was that they realized that in their roles, they weren't really providing themselves with enough self-care. And part of the sanctuary model is really to focus on self-care so that they could continue to help community members in the way that they had been. The other thing that I think was extremely important was that the community leaders really we thought that they would have a high level of compassion fatigue and high levels of burnout, so we had some surveys that really focused on that. But we were surprised to find in the research that they actually had high levels of compassion and really low burnout, so that these community leaders were really resilient in their roles because they really wanted to focus on helping the individuals in their community. And even though at times it was taxing, it wasn't taxing to the level where they didn't want to continue doing the work. So it really showed us that these community leaders are really the key individuals to turn to if we're going to think about trauma-informed services or a trauma-informed region, because these are the individuals that will probably be bearing a lot of the burden in the beginning. There was no resistance really to the work because I believe that the community leaders told us that this was really needed, that they had been doing this work, many of them for many decades. I think the youngest person that was working with us had been doing it for at least 5 to 6 years, and the longest person that had been working had been 40 plus years. So these were really a wide range of helpers in the community, and the ones that once they started doing the work, they were going to continue doing the work. And so they really were not resistant in any way because they were really looking for tools and strategies to continue to support many of their neighbors and fellow community members. So some of the tools that the community members really resonated with were the safety plan, the self-care plan, and community meeting as main tools that they wanted to take back to their community. They really wanted to focus on really what are the care for themselves. That's what we really recognized in talking with them, was that they were doing a lot of this work but didn't really have good plans to take care of themselves. In addition, one of the key tools within Sanctuary is the safety plan. So when individuals were in moments of stress or dealing with many overwhelming situations, when community members were coming to them with different types of losses, eviction, other types of domestic issues, and the stress level could get really high, if they had the safety plan, which included tools that they had chosen themselves that could relax themselves, they can begin to really focus on the issue and not react out of stress. I think one of the things that's really critical is that these community leaders are really living in high stress environments. Even though there's many, many assets, there's still a level of chronic stress that needs to be dealt with. And so giving them actual tools that they could use for themselves as well as for the community members, I think was really key. One of the other things that the community leaders really resonated with was the community meeting. So really understanding how to frame their meeting and get feelings that are really important out on the table before the meeting, really talk about what people's goals were, and then also follow up with how individuals can ask for help. I think one of the things that the community leaders really came away with is that they could work with each other, they could help each other, but if they had a shared language, they'd be able to really help each other much better, and thinking about becoming more trauma-informed as a unit and as a group, even though they were from different organizations. So some of the lessons learned from the research were that community members really have a large burden to bear, but that they're really resilient and that they really love the work that they do. I think one of the other lessons that we learned was that individuals really have a need to really become more trauma-informed and really understand how trauma impacts the brain. I think that the community leaders really felt that that information was critical, and they wanted others to know about that information and how the brain is impacted by trauma. Those lessons really taught us that more needs to be done, and that the community leaders really are the ones to probably lead that charge. One of the other lessons that we learned was that the community was ready to take the tools back immediately. So after developing a plan, they really wanted to begin to use these tools. And so they began using community meeting in their own organizations. They began using self-care plans. They started having community workshops that really discussed some of the topics that we discussed related to Sanctuary. So there really were a number of lessons that we learned that individuals really are ready for this type of information. Advice I would offer to other cities or individuals that are interested in doing this type of research are really for them to stay really connected to the pulse of the community and really have good relationships so that they can really get an understanding of what community leaders and different organizations actually are facing when dealing with individuals that have experienced lots of trauma. I think that the community leaders as well as community service providers should continue to meet regularly so that they can stay informed on really what are the key issues. I think community leaders as well as community service providers should really look to evidence-based tools to begin to use those as ways to implement strategies that make sense for their individual settings. Really feeling that adapting their tools is really one of the key things that they should do. So I think some of the necessary steps are really to make sure that the information that we gather and the research that we gather is really disseminated back quickly to the communities of need. I think many times, and from what the community members told us, lots of research and policy is underway, but that they're not really aware of it and they're not really a part of it. So really figuring out how to get that information back to the community very quickly so that they can begin to use it. And I think one of the things that was really important within the work that we were doing in Southwest was that the individuals not only gained information for the community, they also gained information for themselves that they could put into action and into practice immediately. So it wasn't the 17 years for actual action to take place, but that the individuals were learning about the research, finding out the key tools and strategies, and they had the ability to walk away even after the research right then and there with tools and strategies they could implement the next day. So looking to the future in maybe 10 to 15 years, it would be wonderful if the city of Philadelphia had become a trauma-informed city, meaning that the agencies, the community groups, community organizations all had an understanding of trauma and its effect on the brain and the effect on re-traumatizing individuals if they don't understand how to work well with each other. So I think really in the future, we're really looking for organizations and for community members to really have that further understanding so that we can begin to start treating each other in a way that makes more sense and can prevent further trauma. One of the individuals that was a part of the research was a teacher in a local elementary school. And I think that one of the takeaways that she had after being a part of the research was really that these tools and these strategies needed to be implemented quickly. And so as a follow-up to that, there were workshops that were done specifically at her school that really brought in all of the teachers to begin to train them in trauma and really begin to have them understand that a lot of the youth that they were working with had trauma histories, and that she wanted her place to be an area, a school of sanctuary for the youth to come to. And so she really spearheaded that workshop happening in the community subsequent to her work with us in our research. We were able to attend the workshop at the school and really see what the teachers wanted to learn more about related to the brain and trauma. And it was really eye-opening for Crystal and I as researchers to see the need for this kinds of information. Many of the teachers walked out of that workshop training saying they had never heard any information like that, and that they really wanted to use some of those tools and strategies immediately in their classrooms. And they didn't realize that some of their youth really needed more support. So that training and that workshop was really instrumental. So really having that person who really participated in our research study initially then go back and really spearhead a workshop at her own school really began to spread the understanding of trauma, its importance to fellow community leaders like teachers immediately. So thinking about Philadelphia in the next 10 to 15 years, it would be wonderful to see a number of community leaders come together that have been trained in trauma-informed approaches. So really having a core group of leaders stand at the forefront of understanding what needs to happen and using the evidence-based tools and models that we know that are available to make their communities more trauma-informed. So I think that the community leaders would be disseminating their information back to their community constituents as well as to policy leaders in the city. I think really having a grounding in trauma-informed principles and trauma-informed approaches that really spreads from a grassroots level, but then that also touches the public policy makers would really make the city a place where individuals can really have shared synergies around making the city more of a place where this is understood. So I think looking into the future, we really need to build a system and a network of trauma-informed community leaders that all want to work together, so that when individuals from communities or from different agencies begin to interact with each other, they are using the same shared language of understanding how to really help and make a difference in people's lives.